Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What causes testicular atrophy? Testicular atrophy is the shrinking of your testicles, balls. This is not the same thing as when your scrotum, ball sac, temporarily shrinks and shrivels up when exposed to cold. Rather, it is the actual reduction in the size of one or both of your testicles from what they normally are. /r/n/r/n testicular shrinkage commonly occurs with older age but can also be caused by medical conditions that affect the testicles, like varicoceles or testicular torsion, or medications that mimic the effects of testosterone, like anabolic steroids. Infections, alcohol overuse, and testicular cancer have also been implicated. In some cases, your fertility and ability to conceive may be affected. /r/n/r/nFluxFactory. Getty ImagesrnrnrnTesticular atrophy affects people born with a penis who are typically assigned male at birth. /r/n/r/nVerywell health acknowledges thatsex and genderare related concepts but are not the same. To accurately reflect our sources, this article uses terms like male, man, and boy as the sources use them. /r/n/r/n testicular atrophy is due to the loss of cells that line the network of tubes inside your testicles, called the seminiferous tubules. These include Sertoli cells and germ cells that produce sperm and Leydig cells that produce testosterone. This decreases the volume of the seminiferous tubules and, in turn, the size of your testicles. /r/n/r/n testicular atrophy can also affect the function of the testicles, leading to a decline in sperm count as well as a steep drop in testosterone levels, known as hypogonadism. /r/n/r/n if testicular atrophy occurs before puberty, a person may also experience /r/n/r/n after puberty. Testicular atrophy may be accompanied by symptoms such as /r/n/r/n while testicular atrophy is a decrease in testicle size. It is not the same thing as microorchidism, a condition in which you are born with abnormally small testicles. /r/n/r/n testicular atrophy is generally acquired with age or a medical condition. Microorchidism is most commonly the result of a congenital, present at birth, condition, such as Klinefelter's syndromeorPrader-Willisyndrome. /r/n/r/n The causes of testicular atrophy vary depending on a person's age. Based on the cause, the condition may be reversible or irreversible, and unilateral, one-sided, or bilateral, two-sided. /r/n/r/n Four conditions closely associated with testicular atrophy in children are /r/n/r/n More often than not, conditions like these cause unilateral atrophy, although a significant number of cases involve both testicles. Bilateral testes atrophy may occur due to other causes, environmental or genetic. /r/n/r/n Testicular atrophy in adults has several common and uncommon causes. Specialists known as urologists can often narrow the causes based on whether the condition is unilateral or bilateral, such as with /r/n/r/n One of the main concerns of testicular atrophy is its possible impact on fertility. The risk can vary by the underlying cause and whether the condition is unilateral or bilateral. The risk is most noticeable early in life. /r/n/r/n Examples include /r/n/r/n There is also an increased risk of sexual dysfunction, including erectile dysfunction, ED, among people who experience hypogonadism as a result of testicular atrophy. This is especially common with aging-related hypogonadism, in which 52% of men ages 40 to 69 have some degree of ED. /r/n/r/n Even beyond the risk of sexual dysfunction or the loss of fertility, testicular shrinkage can take an emotional toll. Some people express feeling self-conscious, believing that smaller testicles make them less of a man. This can lead to sexual dysfunction and signs of clinical depression. /r/n/r/n testicular atrophy is often detected when a person suddenly notices that one or both of their testicles are smaller than they used to be. It may also be detected during a physical exam by a healthcare provider, who notices size does not match age. /r/n/r/n Although testicle size can vary from person to person, testicles are generally 4 to 5 cm, cm, long, 3 cm high, and 2.5 cm wide in most mature adults. /r/n/r/n By contrast, testicular atrophy is diagnosed from one of the following characteristics. /r/n/r/n To make the diagnosis, a specialist called a urologist will perform a scrotal ultrasound, which uses high-frequency sound waves to create detailed images of the testicle. Based on the length, width, and height of a testicle, the urologist can calculate its volume and compare it to either a previous scan or the median size of testicles of people your age. /r/n/r/n The specialist will also order a serum testosterone test to measure the amount of testosterone in your blood. Values under less than 250 nanograms per deciliters, ung/dl, indicate hypogonadism and the possible need for testosterone replacement therapy. /r/n/r/n In most cases, the first-line approach to testicular atrophy is to treat the underlying cause. For bacterial infections like gonorrhea, chlamydia, or a severe UTI, this would involve the early use of antibiotics. For viral infections like mumps, the drug interferon may help reduce the risk of atrophy and future infertility. /r/n/r/n Surgery may be needed to repair structural abnormalities like an undescended testicle, varicocele, and, most especially, testicular torsion. Early treatment almost invariably affords better outcomes. /r/n/r/n For shrinkage caused by TRT and anabolic steroids, the discontinuation of the drug may reverse symptoms depending on how long you have taken them and at what dose. Even then, it can take up to a year or more for symptoms to fully reverse. /r/n/r/n Not every case of testicular atrophy can be reversed. This is especially true when atrophy is related to aging or caused by chronic alcohol use. In such cases, the aim may be to prevent further shrinkage. /r/n/r/n Drugs sometimes prescribed include /r/n/r/n Both of these drugs are commonly prescribed to people on TRT who experience testicular shrinkage. However, in both cases the use is off-label, meaning the drugs have not been specifically approved by the Food and Drug Administration, FDA, for this purpose. /r/n/r/n Alternative treatments sometimes used for testicular atrophy are curcumin found in turmeric, traditional Chinese medicines like wutsi yangzong, goji berries, or ginseng, and probiotic supplements like Lactobacillus reuteri. With that said, there is little research to support their use and most of it is confined to animal studies. /r/n/r/n Talking to a healthcare provider about your genitals can feel uncomfortable under the best of circumstances. Discussing the size of your testicles can compound these feelings given that it can open the door to questions about your sexual health and anabolic steroid use. /r/n/r/n As awkward as this may seem, any change in the size of your testicles warrants investigation, especially if it occurs suddenly or with symptoms. Even if it appears to be related to aging, it is worth getting it checked out if you are feeling distressed, anxious, or depressed. /r/n/r/n Urologists are specially trained in diseases and conditions affecting the male reproductive system. As such, they are used to speaking about issues related to the penis, testicles, scrotum, or prostate gland and can tell you if what you are experiencing is normal or in need of investigation. /r/n/r/n To aid with the diagnosis, and make the conversation more stress-free, focus on the facts by simply explaining, /r/n/r/n If you have been trying to conceive but have not been able to, add that to your list of concerns. /r/n/r/n by providing the provider with a clear, concise snapshot of your concerns and answering questions as honestly as you can. They can narrow the causes more quickly without any unnecessary fuss. /r/n/r/n Testicular atrophy is the significant reduction of the size of your testicles. While this commonly occurs with older age, it may also be due to conditions like Microorchidism, Microorchidism, varicoceles, and testicular torsion. /r/n/r/n Testicular atrophy can also occur during adulthood due to sexually transmitted infections, excessive alcohol use, anabolic steroids, and testosterone replacement therapy, TRT. Some of these conditions are reversible with treatment, while others, like TRT, may require medications to prevent further testicular shrinkage. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.